I'd like to ask you the same thing I asked the other doctor. What's a woman?
It sounds like an easy question, but it's a complicated question.
Explain it. Tell me the complicated answer.
Okay, so when we look at biological sex, most people fall into male or female. There's multiple different ways to determine what sex you are. We look at chromosomes, we look at internal sexual organs, we look at external genitalia, we look at hormone levels, we look at various different genetic abnormalities, we look at gender identity, lots of different things. For most of us, those things line up. We call that cisgender. Some folks, they don't line up.
No. I asked you about sex. What's a woman? That's a sex, not a gender.
Well,
There's a difference.
Our last expert said that a woman was somebody who produces ova. That definition is very limited.
But you're combining gender and sex in your medical.
Now I'm talking about sex. A woman is not just somebody who produces ova. What about the woman with androgen insensitivity who is genetically XY and doesn't have ovaries, but feels like she's a woman, looks like she's a woman, doesn't realize.
What percentage of the population is that?
It's not common. I don't know what the percentage
So let's just use the regular, everyday, run-of-the-mill, what's a woman? You say it's complex. Let me tell you, I'm retired from the Army. I'm not going to claim to be the smartest guy in the room. But I can tell you what a woman is all day long, and I can tell you what a man is. My 4-year-old son can tell you what a man and a woman is, and so can my 6-year-old daughter. Yet you're a medical professional telling me it's complicated. And then you're the one that is doing these surgeries to children.
I'm not doing any surgeries to
children. Then you're using puberty blockers. Am I wrong?
I use hormones.
Okay. But you can't define a man or a woman, but my 4- and 6-year-old can all day long. They don't even have to talk about XY chromosomes and double 2X chromosomes. They don't have to talk about that. But I have a medical professional that's gone to school for probably at least 12 years and done residency for 4 is my guess. And you can't define it, and that concerns the heck out of me. Can a man have a baby?
Yes.
Please explain that one to me.
There are plenty of transgender men out there.
I said, can a man have a baby? A man.
Yes, a transgender man who feels like a man in his brain, who has taken testosterone, who looks like a man externally, who occupies a male role in society, who is treated as a man, whose driver's license says that he is male. These people sometimes have babies.
So it's not child abuse in your mind. I gave you what delusional versus dysphoria is, and you say it's dysphoria, and so does your medical profession. You've gone to school for a long time. You tell me that, way longer than me, at least 12 years with your residency, probably 16, and you tell me that it's a complex answer what a man and a woman is. I think that says everything that it needs to say. I appreciate you coming today. We disagree. The science is simple. Gender and sex are different. Medical stuff should be easy when we're defining what a man and a woman is. I'm just
clearly more complex if we're here having a hearing about it.
How is it complex? My 4- and 6-year-old can tell you what a man and a woman is, ma'am. All day long. They can define it easily in the most simple terms. And you tell me it's complex.
Because my patients come to me and tell me what their gender is. They say that I'm a woman.
Scientifically. If a child or a patient came and told you something that was totally off the wall, you would say, hey, that's way off the wall. But when it comes to sex, you're listening to them.
We look at patterns. Lots of people talk about this. Lots of people have this issue.